foodharvest.org to find out how you can help. Together, we can end hunger in America.
If all the drunk drivers arrested in Maryland during the past 3 years were here today, this stadium would be full. If you drink, drink responsibly. Remember, drunk driving, it's not worth the penalty.
I am a walking, talking miracle.
I am here because I survived leukemia,
lymphoma, Hodgkin's disease, myeloma.
I am here because of my strength,
my faith,
my treatments.
I'm here because of you.
Thanks to support for the Leukemia and Lymphoma Society, the survival rate for these cancers has nearly doubled in the last 40 years. Please help us keep the research going. Call 1-888-HELP-LLS.
I am a walking, talking miracle.
I am here because of you.
Welcome back to Mental Health Matters. We're joined by Dr. Annelle Primm, who's been a practicing psychiatrist in the Baltimore area for over 20 years. Today we're discussing the significant problem of depression and how it affects our community. Before the break, you were talking about how depression is debilitating, how depression is often associated with chronic diseases, chronic medical diseases like diabetes and hypertension. We mentioned, and certainly you and I have talked about in the past, the relationship between depression and substance abuse. And I was kind of just sitting here saying, wow, feeling a bit overwhelmed. Let's talk about what, in fact, we are doing as a community, as a mental health community, but some of the projects that you are specifically involved in to address this illness and to try to make a difference.
Well, one, I think, really important strategy in improving health in a community is education. And educating the community has been, you know, one of my passions, really. And one way in which I have sought to educate the community is through the use of educational videotape. And this actually has the advantage of eliminating the gaps that may exist in terms of literacy level, because, you know, you hand people a brochure or a pamphlet on a health matter, and they may not be able to read at the level at which that is written. So educational videotape, and I explored this with one called Black and Blue, which is aimed at the African American community, and actually includes African American adults who've had the illness of depression and who speak about it from their own personal experience. It also includes mental health professionals and a pastor who speaks to some of the spiritual issues, which are just so commonly believed in by members of the African American community, sometimes as the only way of addressing depression. But we really want to get the message across that depression is a medical illness and it requires treatment from a health professional, and certainly can be used along with prayer and religious belief.
Well, before you go any further, though, is one of the reasons also that you have used this approach? Obviously, this is the reason that we're here on Mental Health Matters, to get the word out and to try to educate the community. But is also one of the reasons that you've used this approach because it does help to reduce some of the stigma that is often associated, especially in the African American community, with mental illnesses. I mean, you know, I do a lot of public speaking. I know you do a lot of public speaking. There are many of us who go out to church groups and community meetings, but you still can't get at everybody. You know, you can't touch as many people as you can with this particular media. I mean, it's a way to get the word out so that shows like this, videotapes, folks will watch that who may be reluctant to come out, you know, to a church group or any other group, and maybe folks will know that they're feeling depressed.
Well, that's happened quite a bit. You know, when I've shown the videotape, people will see it and they'll say, that's what's been going on with my brother all this time. You know, I'm so happy I saw this. So it really does help to reduce the stigma and the mystery around mental illness. Sort of extending on the success with Black and Blue, we've developed another videotape, Gray and Blue, which reaches out to another underserved group, and that is older adults. And this particular videotape features older adults who've had depression or who are from a variety of cultural backgrounds. There's also a Baptist minister in this videotape and a Jewish rabbi who speak to the spiritual issues that are often very important among older individuals. So again, trying to reduce the stigma, trying to change attitudes about depression, and really encourage people to seek treatment. So I think those have been very successful, and using those tools, we've sort of expanded beyond that to screening
Talk about
in our
that,
community. What we've decided to do is to use a very commonly used depression screening tool called the Zung. But this time, instead of relying on institutions and health professionals to do the screening, we are training lay people how to screen. Fortunately, the Zung is very easy to score, and it could be given really any place. And so we've been able to attract groups of concerned individuals who are concerned about the health of their community to come forward to receive training in depression, to receive training in how to administer a depression screening tool, and then to collaborate with other interested individuals, including health and mental health professionals, to hold health fairs and other activities that will attract a wide variety of people from the community to actually come and get screened. Some of you may, some people may be aware of the fact that, health screenings are offered with hypertension screening and so forth. Right. But sometimes when there's a mental health table, nobody wants to go that way. But people have found a way to attract folks from the community to get screened, and that is also an opportunity to educate them. We might use the videotapes and other materials. And what we have found is when we compare the number of individuals who we have screened and the proportions of individuals from underserved groups, such as African Americans, Latinos, and others, that we had a very high percentage of those groups who were screened, many of whom were positive, received positive results, were found to be have depressed type of scores, and who were provided with mental health resources of where to get help. And when we compare this to national screening efforts, such as National Depression Screening Day, which occurs in October, where there are very low rates of participation of people from these underserved groups, it lets us know that by using lay people who are part of the fabric of our communities, who have close relationships with people who may not want to come to a health institution or some formal place to see about their health, that this really is an effective way of reaching the underserved individual in our community.
Here you're using people to reach out who may be not nearly as threatening. The idea of talking to someone from your neighborhood who's like you is an excellent way to make people feel more at ease.
Yes, it really breaks down those barriers which we know exist, and we're hoping that by breaking down those barriers, that it will increase access to mental health care and ultimately improve health outcomes, both the mental health outcome and the other diseases that are so common in our communities, and really make for a more productive citizenry, a more healthy citizenry. So we're very excited about these sorts of efforts. We've taken it a step further. We've reached out to the faith community to educate them about depression and to join forces with them to even provide treatment resources in the community that sort of integrate the mental health and the spiritual piece so that people will feel more at ease with receiving mental health services and feel less stigmatized by it.
Well, and that's extremely important because I've often felt that there sometimes is almost a competition between, especially in certain communities, between pastors and ministers and others and mental health services, and so it to me makes good sense for us to partner with them, but I know at times it can be difficult to get that linkage.
Yes, I think what we've come to realize is that the faith community and the mental health community, we have the same goals. We are working for the well-being of the community, of the congregation, and so it makes so much sense for us to partner. And I think that the faith community is really excited about being, an instrumental part of improving the health of their congregations.
How have you dealt with providing education and information to members of the faith community as a way of getting them on board?
Well, we have actually visited churches and provided, educational talks. I've visited several churches and given talks about mental health and depression. They were extremely well attended. We've trained some of the faith community members how to do screening, and they've screened within their own congregations. We have provided black and blue videotapes and other educational materials. I've even spoken at an actual ceremony, an actual service, church service, which was quite an honor. But
yes, it is.
The faith community has really taken us in with open arms, and there have been several successful initiatives that have come out of this.
Well, we're running short of time, as is always happens when I get you in the studio, because you're such a wealth of information. But I do think that it is extremely important to commend you for your energy and your effort in terms of reaching out, because I know how important this community effort has been to you. And it really is about improving the overall health of people, looking at not only their mental health, but the physical health, the interactions, and even the issue of spiritual well-being. That is, in fact, the kind of model of care that you've put forth that I think is to be supported and commended. Is there any way that folks can get a hold of you if they want more information about some of these projects that you're involved with?
Yes, I'd like to give my phone number.
Sure.
It's 410-955-2018.
Okay. What can I say, Annelle? As always, it's a pleasure having you here on Mental Health Matters. You continue to contribute very important things, I think, to the Baltimore community, and it's a pleasure to have an association with you. So keep doing what you're doing, because it matters.
Thank you. Thank you so much.
And thank you, viewing audience, for tuning in again. And remember that if you or someone you know needs help with a mental health crisis, you can call Baltimore Crisis Response Incorporated 24 hours a day. And remember, your mental health matters to us.